Psilocybin mushrooms reverse aging by 57% in humans, 30% in mice? Groundbreaking study explained. Psychedelic mushrooms have been shown to significantly reduce cellular aging in humans by an impressive 57% and extend the lifespan of mice by 30%. This groundbreaking discovery has been made by researchers who are exploring the potential of psilocybin, the active compound found in these mushrooms, as a therapeutic agent for various health conditions. The research team from Emory University has conducted what they claim to be the first long-term study assessing the effects of psilocybin on older mice, which were biologically equivalent to humans aged 60 to 65. These mice displayed typical signs of aging, such as hair loss, graying fur, and decreased physical activity. Initially, the mice were given a low dose of psilocin, the active form of psilocybin that is released during digestion. Over the course of 10 months, the dosage was gradually increased to 15 milligrams per month. Remarkably, within just 3 months, the mice treated with psilocybin began to show signs of rejuvenation, including reduced graying and hair loss, and an overall boost in their activity levels. By the end of the study, those receiving psilocybin had an average lifespan that was 30% longer than that of the control group. Currently, over 150 clinical studies are either completed or underway, investigating the use of psilocybin for a variety of clinical issues, such as anxiety, depression, addiction, neurodegenerative diseases like Alzheimer's, and chronic pain. A notable study from 2020 highlighted that a single dose of psilocybin could alleviate severe physical and psychological symptoms, with benefits lasting for 5 years or more after administration. #The mechanism behind the effects. Research has established that psilocybin interacts strongly with a specific serotonin receptor known as 5-HT2A, along with several other serotonin receptor subtypes. The 5-HT2A receptor is found in various organs and cell types, including skin, brain, heart, and immune cells. When stimulated, this receptor activates a crucial pathway in the body related to aging, called SIRT1. This pathway plays a vital role in managing cellular senescence, a process where aging cells become non-dividing and inflammatory before being removed from the body. The study's authors noted, "We demonstrate that psilocin increases SIRT1 expression in cells, indicating a possible mechanism through which psilocybin may delay senescence and promote longevity." This research provides the first experimental evidence that psilocybin could influence several key aspects of aging, such as delaying senescence, maintaining telomere length, and enhancing DNA stability. They further emphasized that psilocybin's effects extend beyond neurological and psychological benefits, suggesting it may also influence systemic aging processes, which could explain its enduring therapeutic effects across various health conditions. In laboratory tests, scientists also examined the impact of psilocin on human lung fibroblast cells, administering either the psychoactive compound or a placebo until the cells reached replicative senescence, which occurs after approximately 50 divisions. Treatment with 10 micrograms of psilocin led to a 29% increase in cellular lifespan, characterized by a delay in the loss of proliferative capacity, more population doublings, and a shorter time between divisions. Astonishingly, when the dosage was raised to 100 micrograms, the lifespan extension jumped to 57%. The fibroblasts treated with psilocin also showed increased SIRT1 activity and maintained their telomere length. In conclusion, the authors described psilocybin as a potentially disruptive pharmacological agent, a term that resonates given the extensive therapeutic possibilities already recognized in non-psychotic individuals using psilocybin for various ailments. However, there remains a hesitance among major pharmaceutical companies to investigate psilocybin as a viable product ingredient, compounded by the widespread illegality of psychedelic mushrooms in many regions of the world. What are your thoughts on the implications of this research? Do you believe psilocybin could revolutionize our approach to aging and health? Share your opinions in the comments below. Mushrooms fight aging? Groundbreaking study shows how psilocybin extends lifespan. Breakthrough. Magic mushroom compound appears to turn back the clock on aging. But is society ready? A groundbreaking study reveals that psilocybin, the natural psychedelic compound in so-called magic mushrooms, dramatically extended lifespans while improving fundamental markers of cellular health. Published in Nature Partner Journals Aging, the research offers stunning evidence that could revolutionize anti-aging science. Here's what's truly game-changing. Human lung and skin cells treated with psilocin, the compound formed when psilocybin is metabolized, lived over 50% longer than untreated cells. But here's where it gets controversial. Scientists observed equally remarkable effects in live subjects. Aged mice, equivalent to 60 to 65 human years, receiving controlled psilocybin doses showed 30% higher survival rates over 10 months. Healthier fur with reduced graying. Visible hair regrowth. Unlike transient anti-aging trends flooding the $500 million longevity industry, this works at the cellular level. Psilocybin appears to combat aging by reducing oxidative stress, think of rust forming inside cells. Boosting DNA repair mechanisms. Protecting telomeres, those vital end caps on chromosomes that shorten with age and are linked to cancer, Alzheimer's, and heart disease. Dr. Louise Hecker, the study's senior author, emphasized the surprise factor. Most cells express serotonin receptors. Our findings open a new frontier for how psilocybin could influence systemic aging, especially when administered later in life. And this is the part most people miss. While psilocybin is famous for psychedelic brain effects, its body-wide impact remained virtually unexplored, until now. The compound activates serotonin receptors present throughout our entire system, not just the brain. Controversy alert: can a substance known for hallucinations become mainstream medicine? Consider these conflicting perspectives. Dr. Ali John Zarabi, study co-investigator, observes, treated mice aged better, not just longer. As a palliative specialist, I fear extending life without quality, but here we saw genuine health improvements. Yet regulatory hurdles loom. Despite promising Phase 2-3 depression trials at Emory, psilocybin remains a Schedule I drug with stigma attached. The urgency is undeniable. U.S. life expectancy, 78.4 years, now lags 4 years behind peer nations. Psilocybin interventions initiated late in mice still improved survival, suggesting hope for older humans. So we are left with burning questions. Should we prioritize research into psychedelics as anti-aging therapeutics? Does society's perception of psilocybin hinder medical progress? Are we prepared to embrace a mushroom-derived solution to aging? Tell us in comments, would you take a clinically approved psilocybin treatment to combat aging, even if it challenges cultural taboos? Reference: Cato et al., 2025. Psilocybin treatment extends cellular lifespan and improves survival of aged mice in NPJ aging. DOI 10.1038 S41514-025-00244X, funded by Emory University and the Awards.